This is SG2 Perspectives, a conversation with SG2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
If we're talking about ambient scribes, we're usually just talking about the process of capturing conversation, transcribing it, and maybe starting to assist with some of the structured formatting of those notes. There's so much more that could be happening when we start to merge it with some of the other applications of AI.
Welcome to SG2 Perspectives. I'm your host, Trevor DaRin. Today, I get to talk about one of the hottest topics, best success stories across the healthcare provider industry right now, and that's AI scribes. And who else would I want to have this discussion with than Andrew Rebhan, our in-house leader in all things virtual AI, digital health. Andrew, thank you so much for joining us. There's an accompanying post that just came out that Andrew wrote about the same topic that people can read about as well. Andrew, I think most people are looking at solutions, have already implemented solutions, and understand the AI scribe space. Summarize what you've heard from health systems, medical groups that have implemented some of the early, often positive findings. And one of the things I liked best about your take on this topic was, but let's see if there's a ceiling to that. And let's see how much health systems can reap the gains and reap the ROI of this tech. Really promising findings early on.
I've been covering AI for quite a while, and ever since the post-ChatGPT craze, we've seen different pilots and initiatives focus on how to test out this technology in different ways. When you look at what floats to the top, especially in the last year, it's been this focus on AI ambient scribes. We're talking essentially about software that is able to capture the patient visit and support clinicians in terms mainly of their note-taking and documentation for the sake of alleviating some of those administrative burdens that contribute to burnout. Every organization from major EHR companies to large health systems have been piloting this technology. Apart from the press releases and the headlines, I've actually been in rooms with executives from different health systems. Anecdotally speaking, they're optimistic about this technology. So we know that AI has a lot of hype behind it, and there's a lot of skeptics out there, and that's totally fair game. But this is one area that consistently we're seeing, even though there's still areas of concern, areas of improvement, people are generally supportive of ambient scribes and where they can take us in the future.
You have a lot of examples from specific systems. Talk through some of the positives of what they found or some of the places where while there's great outcomes for individual providers, that doesn't necessarily mean it's a one-to-one translation. That savings of time means they get to do something else, seeing another patient, something productive with that time.
If you're scanning news headlines, you're going to see a lot of overwhelmingly positive outcomes, whether it's examples like Reed Health, where they piloted a bridge and their ambient scribe solution. Atlanticare has been one of the early test cases for the Oracle EHR clinical AI agent. Stanford Healthcare has been one of the early leads in the space too. They find these significant reductions in note writing effort. They find double-digit percentage savings for docs in terms of the after work hours that they put in. It's striking to see these headlines, and you have to take some of them potentially with a grain of salt if they're coming strictly from a vendor side. They want to promote a lot of their products in a crowded market, but we can't deny the conversations we're having in the room with executives when they're saying, we deployed this technology even in a pilot stage, and we found that our clinicians were coming up to us and saying, please don't take this technology away. It's actually helping us in our day-to-day work, and particularly with this documentation task. There was a longitudinal study that came out recently from Atrium Health. What they were essentially doing was looking at a group of clinicians that were leveraging one of these ambient scribe technologies and comparing it to the control group that was not using the AI. And they had two primary measures. They were looking at EHR use metrics, and so that could include things like time in the EHR, work time outside of work, time in the notes. But then they were also looking at the financial impact of using these technologies. So that was related to gross revenue per visit and work relative value units per visit as well. And what was interesting about this study was their ultimate finding was that there was no statistically significant difference in the group of clinicians that were leveraging the AI scribe versus those that weren't. That goes against a lot of the optimistic energy we've seen from the press releases and some of the headlines that I mentioned earlier. What's interesting about this is that there was deeper findings behind this. So they did some exploratory analysis and they did some qualitative surveys, and they found that the clinicians who were using the AI, even though looking at the EHR metadata, they didn't necessarily save a ton of time, they still, through surveys, showed that they were reducing task load and work exhaustion scores on these surveys. We're seeing that clinicians are feeling that using this AI is alleviating some of those factors that lead to burnout. And in interviews and in surveys, they're saying, this is giving me a greater sense of work-life balance. If I'm able to save time, that means I get to go home at a reasonable hour. That means I don't have to work on documentation when I get home. Maybe I spend more time with my patients. That's one of the benefits of these scribes, is that you're not necessarily stuck behind the computer during the visit. There's an interesting tension here between objective metrics that were set up around EHR use and financial impact versus some of the qualitative metrics that individual clinicians are thinking about. That's one of the interesting findings from the Atrium study. It's worth mentioning, too, that last year, Stanford Healthcare had done another study using generative AI, not for ambient scribing, but for responding to patient portal messages, initiating a draft to respond to these messages. And what's interesting there is they came to a similar conclusion. They found that using generative AI didn't lead to any significant changes in reply times and read times of the notes. And yet, through qualitative surveys, clinicians were positive about the use of the tool and actually had the perception that they were saving time. So even if they're not necessarily saving a ton of time in terms of the metadata or the objective metrics, there's still a perception of this. I don't know what that means. I mean, does that mean that these tools are still going to be worth it from the experience factor, and we're still allowing clinicians to potentially use this time the way that they want to? Or is there going to be tension or confusion from the organizational level if they're setting metrics and goals around productivity and around turnover and increasing volume, where we might get some misalignment between those two stakeholders?
That's a great story. Thanks for sharing. What's the ceiling on those gains? Is it realized so quickly and easily that there's not going to be continued growth and incremental gains and how much time is saved? What have systems who are kind of early adopters here found? What's the next step in this space, even if it's just perceived productivity?
There's a couple angles to this. We can think about the evolution of the underlying AI itself and the fact that we're still seeing growth in capabilities of these large models. OpenAI is seemingly still releasing some new edition of their underlying LLM seemingly every week. They just launched some new effort around what they're calling deep research. We saw all of the attention around DeepSeek, which is the model coming out of China that blew up the market, at least momentarily, because it was basically a model that could seemingly perform at or even above OpenAI's best model, but for a fraction of the cost. Now, there's a lot of debate there around how this model was actually trained, but it flips the script a lot around how we're training AI, how it's being able to perform at a high level for cheaper costs than what we previously thought, and the fact that this DeepSeek model is an open source model. That's a whole other discussion as well. So there's that equation as far as where is AI going and how are we thinking about the economics of the tools themselves. But then there's the other question around functionality. If we're talking about ambient scribes, we're usually just talking about the process of capturing conversation, transcribing it, and maybe starting to assist with some of the structured formatting of those notes. There's so much more that could be happening when we start to merge it with some of the other applications of AI. I'm thinking of things like pre-charting before a patient visit, or dealing with handoffs, or navigating the immense amount of data that could be occurring in the patient's history. There's this clinical summary categorization that could be essentially merging together with a lot of the scribing functions to really build out something that is a more robust clinical assistant. We know the focus right now, a lot of it is on these AI agents or agentic AI. That's kind of another subsector to this, where you start to have chatbots that handle things a little bit more autonomously. For now, we're seeing scribing is getting to a very real pain point in clinician workflow. There's still a lot of space there to continue to tinker with these tools, get them customized to different stakeholders. A scribe's going to work differently for a family medicine physician than it's going to work for a nurse or a clinical pharmacist or an APP. We got to be able to segment across those different users. We have to think about different specialties. We have to think about different settings. AI scribing and the metrics that we think about value are going to differ in a clinic, in the outpatient setting versus an inpatient setting versus an ED. That kind of evolution is just going to come with time in the market. So there's still plenty of space here, but I would expect that if you're a scribe company and that's the only area that you're operating in, you're probably going to feel some competitive pressure here to start to merge or think about if Epic is going down a certain track, how does that really affect us as a business if we're a point solution for scribing versus being a more robust, comprehensive assistant for the future.
Have you heard, or has anyone reported, different responses from patients? Like on a transactional visit, is the incremental savings in time the same, more or less, than a 45-minute visit with an elderly patient who has early onset dementia, multiple chronic conditions? Any connection to patient types, complexity, and ways this is being used differently, more effectively, less effectively for different patient populations?
I've seen most of the studies focusing on the clinician side of the equation, that point of how we see these scribing solutions adapting to different workflows, different specialties and settings, but also different types of patients and populations and levels of complexity. I had heard anecdotally that these scribing tools, many of them are not necessarily built all that well to handle complex patients, and many of them are not necessarily being used just yet in some of the inpatient settings where you tend to deal with those complexities and longer patient histories where you have to process that data. As far as the clinical studies that I've read, it's mostly focused on the workforce for now.
Super helpful. All right. So what are you paying attention to here in terms of thinking about what comes next?
I'm really curious about the novelty of it and to what extent that's going to wear off a little bit. We're still in a state of being caught up in what these technologies can do, even though we understand AI is always surrounded by this hype focus that tends to bring skeptics out, which is fine. There are still scribe solutions that can produce inaccuracies. They can still produce the occasional hallucination. Scribing output tends to be very verbose, very wordy, tends to have a lot of irrelevant information that may not be all that useful for patient summary, but there's still a lot of potential here for how the technology is going to evolve. The vendor landscape is still going to be quite in flux as we think about some of the companies out there that have been seemingly getting a lot of attention and spotlight. You tend to hear a lot about Nuance with their DAX solution. A Bridge seems to be gaining a lot of traction, but understanding too that there's certain vendors out there that are focusing in on particular segments of the market. I'm thinking of a group like Suki, for example. They tend to cater to smaller to mid-sized organizations that may not have the resources to necessarily invest in a Microsoft-owned product that is known to be quite expensive. So I'm thinking about how that market dynamic is playing out. The fact that these scribes are going to increasingly need to be tailored to different end users, just knowing that the benefits of a scribe solution are not going to be evenly distributed across every clinician that uses this. You're going to have super users who seem to get different benefits from it. You're going to have folks that are not necessarily going to use this on every visit. Is a low volume clinician going to benefit more from a high volume clinician? I'm not sure. But we've seen in the surveys, there are some clinicians that just don't seem to see as much benefit from this. And there could be any number of reasons for that. But part of it is, are we customizing these tools enough to actually make it useful for them? Because we know that just giving them access to AI doesn't necessarily lead to a ton of improvement. We have to actually think about how is this truly serving their needs and the way that they do their job day to day. Keeping attention on pilots, keeping studies going, continuing to pressure test these solutions. We want to be open and transparent about the outcomes. We don't want to gloss them over with metrics that make it seem like this is purely a win in every regard. Asking the tough questions around what are the metrics that we're measuring? How does that align from an organizational level down to an individual level? And ensuring that we're making this work for everyone and understanding that it's not always going to be a financial impact equation. It's not always going to be a dollars and cents question. It might come down to some of those experiential factors that ultimately drive this.
Andrew, thanks so much for giving us both a great landscape and terrific perspective on what's going to come next. Always value having you on and can't wait to talk again soon.
Thanks, Trevor. Appreciate the time.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.